Hello everyone, today we start Hematology, and today I want to tell you about hematological malignancies such as leukemia, lymphoma and myeloma. Sometimes it's quite difficult to distinguish them because there are lots of um, very similar symptoms such as weight loss, fatigue, anemia. Anyway, also there are some differences, and today I want to tell you about them. Okay, let's start with leukemia. Leukemia divided into two big groups, acute and chronic, and at the same time they are also divided into two groups, and acute divided into acute lymphoblastic and myeloblastic leukemia, and chronic divided into lymphocytic and myelocytic leukemia or myeloid leukemia. And you already see these differences. So if you see blastic, it means these cells will be immature, they will be big and immature, and in chronic leukemia cells will be smaller and mature but non-functional. Okay, and now let's talk about symptoms. For acute lymphoblastic leukemia, it's a malaise, pallor, and also bone pain, and average age will be 2 peaks when they are children from 2 to 10 years old, and they are 40. And for myeloblastic leukemia, symptoms will be malaise, pallor, and also oral problems like gingivitis, stomatitis, or gingival hypertrophy. Okay, and the average age will be 55-60 years old. For chronic lymphocytic leukemia, symptoms will be fatigue, weight loss, fever and night sweat, and also lymphadenopathy in the neck, axilla, and groin. Chronic myelocytic leukemia, this fatigue, fever, night sweat, and also splenomegaly. And when we also can find Philadelphia chromosome. And the average age for lymphocytic leukemia will be older than 60 years old, and for myelocytic leukemia it's usually 60 to 40 years old. Okay, and now let's talk about lymphomas. There are non-Hodgkin and Hodgkin lymphomas, and non-Hodgkin lymphomas is much worse than Hodgkin lymphoma. Okay, and symptoms will be quite similar. It's malaise, fever, night sweat, the base symptoms, and pruritus for Hodgkin lymphoma. And for non-Hodgkin lymphoma will be also malaise, fever, night sweat, and lymphadenopathy. But for Hodgkin lymphoma, there are also lymphadenopathy, especially cervical nodes, and there is a very specific symptom like alcohol-induced pain in large lymph nodes, and these people will be younger. It's usually the average age is 31 years old, and for non-Hodgkin lymphoma it's usually people older than 60. And let's talk a bit about risk factors for non-Hodgkin lymphoma. It could be some autoimmune disease like rheumatoid arthritis or SLE or Hashimoto thyroiditis. Also some chronic inflammations due to H. pylori. Also, it could be also patients who have been treated for Hodgkin lymphoma. So the treatment is high dose of radiation and chemo, and after this treatment, they non-Hodgkin lymphoma can transform into non-Hodgkin lymphoma. And now let's talk about multiple myeloma. It will be 65 years old person with anemia, high ESR and back pain, and we can diagnose it using serum and urinary electrophoresis, and we will see paraprotein in serum and Benz-Jones protein in urine. So, and treatment will be chemo, and for young people it will be stem cell transplantation. It's quite severe disease, and with many complications. Okay, and thank you very much for watching me, and bye bye.